This is a See Jason podcast, and I am Megan Griffith from Imperial College Hospital, NHS Trust in London. I am the Chief Investigator of the MINTAC trial, and I am delighted to have the opportunity to share the results with you on behalf of all the investigators. Minimal change disease is the cause of nephrotic syndrome in up to 25% of adults. First-line treatment to date has been with high-dose steroids. Although this is usually effective, a prolonged course of treatment is often required and relapse rates are high. Patients with minimal change disease are therefore often exposed to high cumulative corticosteroid doses and are at risk of associated adverse effects. The MINTAC trial investigated whether Tacrolimus monotherapy without corticosteroids would be an effective treatment for de novo minimal change disease in adults. This was a multi-centre, prospective, open-label, randomized controlled trial involving 6 nephrology units across the United Kingdom. Adult patients with first presentation of minimal change disease and nephrotic syndrome were randomized to treatment with either oral tacrolimus alone or prednisolone. Patients in the tacrolimus group were treated with an initial dose of 0.05 milligrams per kilogram twice daily with target plasma trough levels of 6 to 8 nanograms per ml. Patients allocated to prednisolone received initial doses of 1 milligram per kilogram per day with a maximum dose of 60 milligrams per day. Once in remission, patients in the tacrolimus group were treated for a further 12 weeks. The tacrolimus was then weaned and stopped. Patients achieving remission in the prednisolone group received high-dose prednisolone for a further week post-remission. The dose was then gradually reduced, with patients receiving a minimum of 16 weeks treatment. The primary outcome of the trial was complete remission of nephrotic syndrome after 8 weeks of therapy. The results of the trial showed there were no significant difference between the tacrolimus and prednisolone-treated cohorts in the proportion of patients in complete remission at 8 weeks, 16 weeks or 26 weeks. There was also no significant difference in relapse rates between the groups of patients who achieved remission with either tacrolimus or prednisolone. At 12 months, there was no difference in kidney function between the two groups. So, in summary, the MINTAC trial suggests that Tacrolimus monotherapy can be an effective alternative treatment for adults with newly presenting minimal change disease who wish to avoid steroid therapy. I want to close by thanking all the collaborators in this study and, most importantly, the patients who took part.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.